America's high use of pharmaceutical treatments is resulting in more illnesses and diseases becoming resistant to treatment. The FDA reports that almost all bacterial infections in the United States are becoming resistant to antibiotics. Along with this resistance, we are seeing more transformation of diseases. Lymphoma, which was once considered the most survivable cancer, has seen a rise in cases that transform into an aggressive and often fatal disease. There has been a rise in the number of chronic illnesses and conditions that are being diagnosed. The Centers for Disease Control reports that as of 2012, about half of all adults had one or more chronic conditions. And arthritis is the most common cause of disability, with 54 million adults being doctor diagnosed. The connection between nutrition and health has been studied and documented for years. Diseases such as heart attacks, strokes, obesity, and osteoporosis can be prevented through good nutrition. Nutrition can also play an important role in the treatment of illnesses and disease. According to Wikipedia, nutrition therapy is defined as a therapeutic approach to treating medical conditions and their associated symptoms through the use of specifically tailored diet, devised and monitored by a medical doctor, registered dietitian, or professional nutritionist. This type of therapy is being utilized in treatment plans for many diseases, including cancer. According to the Centers for Disease Control, 4 of the top 10 causes of death in 2017 are diseases that can be affected by your nutrition, with heart disease being number 1 at 633,842 deaths. According to a Consumer Reports article titled Too Many Meds, America's Love Affair with Prescription Medication, more than half of us regularly take prescription medications, and in 2014, about 124,000 people died from adverse effects of prescription medication. Prescription medications are often prescribed as preventative, but then the side effects caused require more medicine to treat them. Couple the use of pharmaceuticals with the preservatives and chemicals in processed food, and you can't help but see what we put in our bodies matters. There are many herbs that have medicinal properties that could be utilized in our nutrition, such as turmeric, which has anti-inflammatory properties that can be used to lessen the symptoms of arthritis. There are herbs that have antifungal, antibacterial, and antiviral properties. Garlic is a potent antimicrobial, and studies have shown that regular use of it can help gently lower blood pressure. Thyme has significant antimicrobial and antispasmodic properties that are highly regarded for relieving coughs, colds, and congestion. Cinnamon is a powerful antioxidant that can help fight diseases such as cancer, Alzheimer's, diabetes, and Parkinson's. Carcinic acid, which is a compound component of rosemary, is believed to protect the brain from free radical damage and can lower the risk of stroke and Alzheimer's. Many of these herbs can be added in our everyday use by adding them to our meals, and others are readily available as dietary supplements. These herbs can help a range of conditions from anxiety and depression to menstrual and menopausal symptoms. I must add a disclaimer here, as I do not recommend taking just any herb without doing your research, checking with your doctor for possible side effects with your current medications, and being informed of all the benefits and risks associated for your particular situation. But by adding more natural elements to our food, or even using them in supplemental form, we may be able to bring our health back into balance without the use of pharmaceuticals and without the high incidence of side effects. By taking a good look at your conditions, you may find that there are ways to treat it with activity, natural treatments, and possibly other alternative treatments. We can start to cut the resistance our bodies have to pharmaceutical treatment and make medicine more effective when it is needed. We could even possibly stop the mutation and evolution of certain diseases, all by being mindful of what we put into our bodies.